have a plethora of knowledge that spans a lot of information. Even those who specialize have that very in-depth information and knowledge about medications that a lot of other health professions do not. I'm Traci Poole. I'm the Director of Clinical Services here at Riverside Village Pharmacy. I'm also a full-time faculty member at Belmont University College of Pharmacy and Health Sciences. So normally we come in about 8 o'clock and try to get ready for our patient load, just look on our calendar, see what kind of appointments we have coming up. And then I start my day with my students. I train students here 7 months out of the year. And I also have a pharmacy resident. And so we kind of huddle up, figure out what we need to do for the day, get started with any patient care activities. So if patients have any upper respiratory symptoms, we're able to offer any testing services from RSV, influenza, COVID, and we even offer strep as well. So if they have kind of that sudden onset of the sore throat. So we typically will ask them kind of what their constellation of symptoms are and then recommend the test from there. We have a medical director who has allowed us to do a collaborative practice agreement. And if someone tests positive, especially for flu or strep or even now COVID, we're able to prescribe the medications to get you well before you leave the door. It's really well received. We kind of started this with COVID. And so we had so many members of the community who were reaching out trying to get tested because of the extensive lines and things like that. And so once we started that, they got really comfortable with what the pharmacists could do. At first they were asking us, are you a nurse or whatever? And so now they're very comfortable that pharmacists can offer these services. And then when we added the treatment portion to strep or flu, and then of course with Paxlovid, they were even more thrilled because they didn't have to continue on to another appointment, pay that extra fee, have the same thing done, and then get the prescription. So it was really well received in terms of the convenience to get them kind of better quicker. I think access is everything. In our community, especially, we have a lot of creatives and people who are self-insured, entrepreneurs, and so they don't often have the resources to spend at a primary care office or whatever. And so us offering just kind of that cash price has been really nice for accessibility, and then how quickly we're able to perform the service. Things now that the pandemic has kind of simmered down, we're able to get people in much quicker. They don't have those long wait times. A lot of times we can get walk-ins taken care of. And so I think the accessibility has been a huge sell for us. We have appointment software where if you kind of know, I've had strep before, I think that's what this is, you can get online, make the appointment, whenever it's convenient for you. And then if you walk in, we just kind of work you in depending on what else we have going on. And it usually doesn't take much more than 10, 15 minutes to get you a spot. My first job was in long-term care as a technician. When I became an intern, I started working at CVS as a pharmacy intern. And I actually worked with one of my faculty members. And I saw her counseling a patient one day. And I don't know what it was, but it was like just this spark. It just hit me all of a sudden. I knew exactly what I wanted to do, and I wanted to be her. And so from that point on, I kind of took that path where I did a community pharmacy-based residency. I came straight to Belmont, took the faculty position there, and then ever since then I've been working to empower community pharmacists to practice at the top of their license. I did take a little detour in pharmacy ownership, which was really interesting, and that's how I ended up at Riverside Village Pharmacy. I ended up selling my business to them and coming over to do the Director of Clinical Services. But the common thread has always been education for students, for the pharmacists out in the community, and then also just for our patients as well. I love sparking the agents of change. I love to see students get the bug to want to promote pharmacists for all that we can do, and to really push the envelope of scope of practice or advocacy, whatever it is, to really stand firm and that pharmacists have a role in this community wherever you are. Willingness to listen, that's something that I've worked on quite a bit in my 14-year career, but willingness to listen. We learn as much from our students as they do from us. Being open to try new things, really kind of thinking about innovation in a different way. It's not always about making money, it's about how we teach and train and ebb and flow with the generational differences of learning. And then I think just allowing students to work independently. We don't just count by fives. We have a plethora of knowledge that spans a lot of information. Even those who specialize have that very in-depth information and knowledge about medications that a lot of other health professions do not. Which is why it makes us such an integral part to the team, because we really bring such a specialized piece of information across healthcare, and then we've had to pare that down if you do specialize. But just that ability to continue to learn all about the new drugs that come out all the time, but then also really dive into beyond the dosing. It's really how the drugs work and what they do to the body and all of that. We are more.